Welcome to Beyond the Scar, C-section stories and strategies for healing. This podcast is dedicated to helping cesarean moms not just recover, but truly thrive after their birth surgery. I'm your host, Nicole Alfred, registered massage therapist and C-section recovery coach. And I'm here to guide you through your journey of postpartum recovery with a blend of real life stories and expert advice. Each week, we dive into the experiences of incredible moms who have navigated their own recovery paths. And then we're also going to hear from experts who provide actionable strategies for a holistic approach to your postpartum. From physical healing and emotional support to practical tips for balancing self-care with motherhood, this podcast is here to equip you with the tools and the inspiration that you need to live a healthy, fulfilling life after birth. So, whether you are in the early stages of recovery or you're looking for ways to enhance your healing journey, you're in the right place. Let's get started and thrive together. Hello, everyone. Welcome to Beyond the Scar podcast. I am your host, Nicole Alfred. Today's episode is all about navigating your recovery in one of the most challenging aspects of your postpartum recovery, which is navigating pain, managing that pain after surgery. After a C-section, pain can come in many forms, whether it's discomfort around your incision, your lower back, or muscle soreness from adjusting to new routines. And while some pain is expected, it doesn't have to be something you suffer through without any kind of relief. There are very effective ways to ease this discomfort and making your recovery process more manageable. In this episode, I'll be sharing some strategies to help you manage and alleviate these common postpartum pain issues. So grab your tea or coffee, find a comfortable spot, and let's get into it. So let's talk about some common types of postpartum pain after a C-section, and then practical ways to manage them. First one, incisional pain. This is often the most prominent pain that you're going to experience right after surgery. And while it's important to rest and allow your body to heal, you can try to apply a cold compress around, not directly on the incision, even with a barrier, like a piece of cloth or a towel in between. Even the gauze that you have on there is a nice barrier. And the incision site to reduce swelling that you're having after surgery. Once your doctor gives you the green light, gentle scar massage can be really helpful to reduce sensitivity and improve mobility around the scar tissue, but we're not going to be doing that until at least 4 to 6 weeks, as long as there's no sign of opening in your incision or infection. Lower back pain is another one that is really common. Many moms experience back pain from adjusting to new postures while you're holding and feeding your babies, usually very hunched forward, and then using a supportive pillow, standing with your feet flat on the floor, keeping your back straight up, and your pelvis tilted more forward to give you that lower back kind of curvature. This can all help ease some of that tension. You also want to incorporate gentle stretching and exercises for your lower back so you can alleviate some of the stiffness. I love squatting to begin with in that first day postpartum, even practicing a squat, lunges, when you're lifting baby, practicing these movements as well. You want to turn those muscles back on. Abdominal discomfort and muscle soreness. Your abdominal muscles have gone through a lot of changes and you might feel soreness and weakness in your body. Gentle core exercises like pelvic tilts, seated 360 breathing exercises can be helpful to strengthen these muscles and reduce discomfort over time. Again, these can be done in those first couple of days postpartum. Neck and shoulder tension. This is a really common one that you're going to experience in postpartum. This often can be caused by that poor posture during feeding sessions or carrying your baby. And be mindful of your posture. Sit up straight, keep your shoulders back, use pillows to support your arms during feeding, especially with breastfeeding and you're getting used to that. Remember, you don't bring your body to your baby, you bring your baby to your body. So pillows are really helpful and a really supportive chair is helpful there too. General body aches that you might experience are common to feel as your body readjusts after a C-section. Once you're okay to go into a bath, that can be helpful. But in the meantime, gentle massage to the areas of your body that are feeling sore Either you can do self-massage, you can ask your partner or family member to massage you. You can even go for a massage to a massage therapist. Stretching exercises like, standing in a doorway, opening up your shoulders to stretch your chest. I love hip flexor stretches in those first 6 weeks. They're going to promote relaxation and overall comfort in your body. And if you ever feel that the pain you're experiencing is severe, it's not improving with any of these strategies, it's important to reach out to your healthcare provider for additional support and guidance. So along with these targeted strategies, there are holistic approaches that you can use to support your overall well-being and alleviate pain. Mindful movement, I think for me, is number one. Gentle movement such as slow walks, gentle yoga stretches, these things can promote blood circulation, which is also going to help reduce pain and stiffness. And if we're talking that incisional pain in that first week or two, getting your digestion in order and getting that back on track is going to be helpful with not causing that extra, swelling and bloating in that lower area where your incision is. Make sure that any movement that you do feels comfortable and does not strain your body. Now, they tell you at the hospital, don't lift anything heavier than your baby, but if you're anything like me and you give birth to big babies, that doesn't always make sense. So really, we want to try not to lift anything that's over, I would say 10 pounds. And if your baby is over 10 pounds, don't lift them with a car seat, and practice that mindful posture and movement while you're doing it, like a proper squat. Breathing techniques and like deep breathing exercises can help you relax and alleviate tension in your body and in your pelvic floor. Trying to practice inhaling deeply through your nose, making sure when you're inhaling that rib cage is really getting to the fullest range of motion at that fullest capacity to get a nice stretch in there. And then same when you're exhaling to contract the muscles in the rib cage. It's a great way to center yourself and ease any stress-related pain. I know some people like to hold their breath while they're breathing for a second or two. So breath work can be really, really helpful, especially if you're adjusting to the emotional and mental load after a cesarean. It was an unexpected cesarean. Before we go further into today's topic on managing pain in postpartum, I want to share a really quick thing with you that can make a huge difference in your recovery. I've created a 14-day early C-section recovery guide, and this is designed to support you right after your surgery. So whether it was planned or unplanned, this guide is going to give you everything you need to feel prepared, regain your strength, and reduce your pain in those early days of recovery. The best part, it's delivered straight to your inbox and you can access it instantly on your phone. So all the information, the tips, and the strategies are right at your fingertips whenever you need them. Whether you are laying in bed or on the go, this guide will help you manage your recovery more smoothly, starting from day one. So go over to the show notes. The link will be in there. You can also check it out on the link in my bio on Instagram and get started right away with everything you need to feel stronger and more confident during your healing process. Nutrition and hydration can be really helpful because we want to stick with foods that are easy to digest and that will actually help with inflammation and pain in your bodies. Eating a balanced diet, staying hydrated to support your body's healing process. Consider incorporating anti-inflammatory foods like leafy greens, fatty fish, nuts. These all will help you manage that inflammation and discomfort. I love bone broth, sipping on bone broth every day. Warming foods are really popular in the eastern part of the world, and I think there really is something that is beneficial after having surgery and your digestive system is not working great yet to be eating those warmed foods. Any kind of like blended soups, smoothies can be really helpful as well because it's, again, not as hard on your digestive system. Self-care and rest. This can feel really difficult to do when all of a sudden you have this new human who needs you for every single thing. But you need to make rest a priority whenever you can. Taking short naps, asking for help from family and friends, or even just creating small moments of relaxation can all contribute to overall recovery. So I am not a napper. I am not a daytime napper. Maybe I nap in those first 2 weeks postpartum because you are just really exhausted. But with this third C-section I just had, I didn't. And it's not that I was wired and I was pushing myself too hard. I'm just not a napper. So for me keeping my phone in another area of the room, notifications turned off, the room is dark, I'm able to close my eyes or just lay there. To me, that's rest, even if I'm not actually sleeping. So remember that rest can look different for everyone. So let's take a moment to recap some of the key points from today's episode. Number one, pain is a common part of postpartum recovery after a cesarean, but it shouldn't be something that you have to suffer through. There are really effective things that you can do, like gentle massage to your body, proper posture, stretching exercises. And then once you're past, your incision has closed and you're past that 6 weeks, scar massage can be as well really helpful to alleviate discomfort in your scar. So these things all can be very helpful in relieving any kind of discomfort that you're feeling. Holistic approaches such as mindful movement, deep breathing, and proper nutrition all play a vital role in managing pain and promoting your overall well-being. And every mom's recovery is unique. So be patient and kind to yourself. Try your best not to compare yourself to your previous recoveries, whether vaginal or cesarean, to not compare yourself to friends and family that have been through a cesarean, because you are going through your own unique recovery. And don't hesitate to seek additional support from a healthcare professional or a postpartum coach like myself. And I hope that today's episode has given you some valuable insights and practical tips to help you navigate postpartum pain with confidence and care. And don't forget to like and share this podcast. Leave me a review below so that I can reach more people and help them with this podcast. Thank you so much for joining me on this episode of Beyond the Scar. And I look forward to connecting with you on the next one.